back in April, I had to have my gallbladder taken out. And I don't know if this is a byproduct from that surgery, but when I got home, I was in the hospital maybe 2 days. When I got home, I found that I no longer need anti-acid medication. So instead of taking one a day, I take maybe 2 a month, only when I know that there's going to be an acid.
So one of two things. So basically what he's saying is that his acid reflux was almost cured when he got his gallbladder out. So it's one of two things. Either what you and your doctors thought was acid reflux was your gallbladder acting up for a couple decades, or the extra bile in your stomach might have been creating more of an acid environment, or some reason loosened there's a muscle at the bottom of our esophagus that keeps the acid in our stomach where it belongs, or it was loosening that up a little bit and allowing more reflux. So I would bet a significant part may have been what you thought was acid reflux was your gallbladder. So it's nice that you know.
For that long?
Yeah, if you've got gallstones that are just bouncing around in there and every now and then just kind of blocking, and they block the flow, but they're not, the gallbladder, when it becomes really bad, it's when the stones actually get lodged in the duct and they block all the flow of it. So you were probably just getting a partial sluggishness of your gallbladder that just one day something maybe popped into the duct and created problems, so you got your gallbladder out. So yeah, you can have, I mean, people can go decades with gallstones. If you get these big, massive gallstones, those are the best ones to have because they're not going to cause problems. It's those little itty-bitty ones that are going to get stuck. So.
Question.
Yes?
Hi, what's your opinion on the origin, I guess, on the recent proliferation of food allergies, specifically nut allergies?
So, back when drug reps were allowed to do nice things for us, I was at a Phillies game, listening to an allergist talk, and there's these sound bites you just remember. And I remember him saying that the ones who don't get allergies are the snotty-nosed kids who eat their boogers. And that's a memorable line. And his comment is that allergies are becoming much more common the more we become germaphobes and don't allow our kids to get dirty and get exposed to all kinds of things. So therefore we tend to develop food sensitivities. So the whole food sensitivity, there's a difference between allergy, which is where the peanut allergy, where kids will stop breathing if they eat peanut. That's a true allergy, it's a bad thing. Sensitivities is a different part of our immune system where it can contribute to things like migraine headaches, and fibromyalgia, and anxieties, and a lot of these things where some people will have gluten and other food sensitivities contributed to a lot of their symptoms that they're having, maybe multiple, if you're sensitive to a bunch of different, you're allergic to a list of medications this long. That may be genetic, but there may be some food sensitivities components. So it's one of those root causes that I talk about that could be contributed to it. And when people have leaky gut, I mentioned it before. So leaky gut is when the bacteria that are supposed to stay into your intestine leak into the bloodstream, and the bacteria and the acids they produce spray everywhere. Well, the two main contributors to leaky gut are the bad mix of good and bad bacteria that kind of make the junctions in the intestine leaky. Instead of being tight junction like this, it loosens them up. Or we think a portion is food sensitivities or toxicities like pesticides in our non-organic foods that are causing an inflammation in our intestines. So inflammation from the sensitivities, and then the leakiness from the bad mix of bacteria, and then it kind of feeds on itself, where sometimes the inflamed environment allows the bad bacteria to grow more, and so most people have a combination of the two. So if we identify leaky gut, then the treatment is work on the bacteria mix and identify and eliminate the food sensitivities. Did I answer your question?
I guess I'm always curious about why specifically nuts and peanuts, and why there's been like an upshoot in like true allergy, not like a sensitivity, but like deadly anaphylaxis reaction.
This would be more of an editorial comment than based on strong science, which I try to do. But I think a part of it is our germaphobe environment, where we are super clean. I mean, you watch some parents are probably like this. I don't mind my kids getting dirty and messy, and I try not to never eat their boogers, but that's extreme. But bottom line is that, yeah, we have to be clean, but I think that may have contributed to some of it. I'm not accusing any parents if they got, that's the reason that they had it. There is a genetic predisposition, but the genetics isn't going to change much in 20 years that we're starting to see more of this. So, actually, well, let me comment about autism in a second also, after we're done this. But, so, the true food allergies, I can't explain as to why, but I bet you it's in some capacity. The food industry in our country has changed massively since about the early mid-'80s. Back when things, you started seeing all the artificial sweeteners, you started seeing high fructose corn syrup, obesity started exploding, the diabetes started exploding, things changed massively in the food industry in that time frame. That's got to have played into it some way, because that's going to foul up our guts. So I think that's kind of the quick shift. It's not our gene pool that's mixing, it's some epigenetic component that's playing into the expression of people who are genetically susceptible to that kind of a thing. Piggyback that on the whole, why are we seeing more autism spectrum? Is it just because we're recognizing it more, or is it because it's definitely increasing? Well, Dr. Perlmutter in his Brain Maker book devotes an entire chapter to autism in patients of his. Now he, as they will do and to try to promote their book, they'll give some of the more extreme examples, but I believe them that these are real patients. Patients who are dramatically improved on their autism spectrum and became more highly functional. And I've got one kid in my practice, he's about mid to late 20s now, where I met him, he had improved a little bit, but he massively improved in his autism spectrum when he started owning his health. He lost a lot of weight, started eating healthy, started exercising like a fiend, and now his older brother, who was always the mentor, and he always kind of felt inferior to, he said that he's my hero because he's just so transformed his life totally, and his brain has massively improved. And I believe that it's something that originated in his gut from his improved exercise, nutrition, and weight. That he did it, because Dr. Perlmutter goes into the details in his book, Brain Maker. Yes?
Flu shot.
Flu shot. If you've got cardiovascular risk, without question. They've done studies where people who have cardiovascular risk and have gotten their flu shot have a 50% reduction in the incidence of heart attacks and strokes if they've had a flu shot. Going back to inflammation. Influenza is a massively inflammatory disease. The reason we get fevers is our body fighting off that horrible infection. So we treat, if you mount a massive inflammation to fight the flu virus, as we need to, and you have a vulnerable plaque sitting in the heart ready to burst, pop the bubble, that's a heart attack. So you get 50% reduction of heart attacks and strokes in people at risk. And it's actually one of the ways the CDC monitors flu outbreaks, is they look at heart attack activities in cities, and if they see kind of an uptick, they kind of looked, and they oftentimes will find the flu in there. And other people, if your immune system is some other way compromised, and the reason most people do, I mean, is a public health thing. 90% of the cost of influenza is lost work time. And so there's definitely health, but I mean, younger, healthier people, and you feel lousy for a week. And anybody who has the flu once, it's not a cold. People who gets the flu once says, I'm never going to miss my flu shot again. And people feel like they're going to die if they have the flu because they just feel so miserable. Question?
Good.
I have arthritis in my shoulder.
Mm-hmm.
My doctor, it's moderate. My doctor said take naproxen.
Okay.
And naproxen ends up upsetting my stomach at times.
Mm-hmm.
So I just deal with the pain.
Yep. So naproxen and all the Motrin, naproxen's Aleve, and all the anti-inflammatories. So most arthritis is non-inflammatory mechanical wear and tear arthritis. Some of it is like rheumatoid, is inflammatory arthritis. There's a big difference. So most people who have run-of-the-mill shoulder from old sports injuries or whatever, you're not getting an anti-inflammatory effect. For over-the-counter ibuprofen, you have to take 12 of them a day to get the anti-inflammatory effect. So when you take 2 over-the-counter Motrin, it helps out with your pain. It's not on the inflammation, it's pain relief. So if you're having a bad day and you need it for pain, or you're going to be doing something, you do some work, you need to use it for that. But it's not for the inflammation, and it's really nothing other than just pain control. And yeah, it thins out the layer of the mucus layer of our stomach to make you more prone to stomach upset and potentially ulcers if it goes long term. So yeah, I mean and it potentially can foul up gut bacteria too. So it's one of those chemicals that just use it if you need to, but don't use it if you don't need to. And the best approach to arthritis is exercise.
Yeah.
Soft tissue mobilization, that's a whole other talk. Soft tissue mobilization. Strengthen that which is weak, stretch that which is tight to get all the arthritic joint to fall into place, especially in the shoulder, the back, and the neck. Not that everything, all the dynamics going to become in balance. I'm not Eastern trained, but there's a lot of Eastern medicine that has a lot of value. We need to kind of blend Eastern and Western a lot, and that's a whole Eastern concept to kind of everything being in balance, the chi. And if your neck is exaggerated curvature because everything's tight and weak, your neck's going to hurt. So, sure.
I got a couple of things real quick, if you have a couple more minutes.
Sure.
Okay. One of the things is something that I do that you recommended, which is come to your office and get the artery checked out, the main arteries. Can you tell them a little bit about that? And is that offered to someone that's not a patient?
Yeah, actually, that's why I've got this clipboard here. Thank you. We didn't even talk about this. We're just connected. You know, so
we're here to bring value. That's the bottom.
Well, I mentioned on the this right here. So the approach of mapping is assess for early disease. Dementia, we're getting stuff. We're not there yet. Cancer, breast, prostate, whatever. Heart attack and stroke. So a stress test is absolutely not a screening test for cardiovascular disease. You've got to have a 70% blockage before the stress test is going to be abnormal. 86% of heart attacks occur in a blockage that's less than 70% blocked. So you're going to miss 86% of heart disease in a stress test. Eventually we got something called a coronary calcium score. Who's heard of a coronary calcium score? I don't know, very few. I'm surprised. Usually more people than that. That used to be the best method. There's a significant weakness to it. I won't get into that. So what now that has been discovered is you hear about these plaque regression studies where statins reduce plaque. Well, now with, wish I had one more slide on here, a picture. But the disease of an artery occurs in the wall of the artery. And so now, those of us who are older and have older kids, we remember OB ultrasounds when our wives were pregnant, where it was just a kind of this smudge on the screen. You could see the baby moving, but not a lot of detail. The detail in modern day ultrasound is really cool, watching the fingernails, the hair, and all that stuff. Well, they've leveraged that 21st century ultrasound technology with software, and now we can actually, in this big old artery in the neck, not just look to see how the flow is. Some people in the room probably have had a carotid Doppler ultrasound. Well, that's just like a stress test. They watch the blood flow through the artery, and if there's a blockage there, it's like sticking your finger over a garden hose and you spray your car. Well, in order to get by your obstruction of your finger, the water speeds up. Well, that's what happens in your neck with the standard old-fashioned carotid Doppler, is the Doppler changes colors when there's a blockage, but you've got to have a 50% blockage there. So now they've got this ultrasound technology, which it drives me nuts that more cardiologists haven't gotten on board with this, even though they're one of their top two organizations, the American College of Cardiology, had a couple great articles speaking highly of this test. But the problem for them is that you find preclinical disease. You don't treat it with a stent. Cardiologists don't do anything to treat it when they have it, and they don't understand the value of the prevention of it. But what it allows me to do is, number one, it gives you three pieces of information. It puts the cursor on the artery wall and measures how thick that artery is. And when you've got thickness in your artery, that's some combination of inflammation, everything gets inflamed, gets plump, and cholesterol buildup, some combination of the two. So they measure how thick it is, they put it on a curve, and they tell you at what age you would be average. And if you're a 48-year-old and you've got the arteries of a 63-year-old, that's really motivating. You don't want to hear that you're 63 years old when you're 48. Or if you've got some heart disease and you find that you're 63 and you've got the arteries of a 48-year-old, it's working. You've actually thinned out to someone much younger than you are. So that's one piece of information. It can show individual plaques on there. Anything over 1.3 is significant. The cardiologist not going to do anything. You've got to find out why is that little goober there, dig into root causes, and see which engines of disease are leading towards that forming and address them so that it never becomes a problem. Dr. Bale in his book believes everybody can eradicate. We don't have to have heart attacks and strokes. He says pretty extreme, but I do believe we can prevent a lot of them. And then it can tell you if you do have a little plaque, is it a soft, juicy, inflamed one that's going to, those are the ones that pop and cause events, or is it nice and calcified like you want it to be? Calcified plaques aren't going to rupture and cause events. And I've had many people where we start working on things, they go from a soft, dangerous plaque down to a calcified, safe one, and we know what we're doing is working. So we do that in our office every 2 or 3 months or so. And it's we give a receipt for it. If people have out of network, they can bill it to their insurance or use a HSA, FSA funds for it. It's $100. So what it's for the crew, usually for non-patients we charge $240. For our patients we charge $190. And for anybody from this event, we'll charge the patient cost of $190 for it. And then basically you get the results, and I put my comments on the report. So, but our next event's going to be on, we just had one, October 30th is our next one. So if you want to do that, just either give me your business card so I don't have to worry about reading handwriting, or you can write it down here on the clipboard. Just your name and your email, and we'll send you. Actually, you know, I've got an article I wrote on the test that explains the value of it in more detail than what I'm talking about here. But if you put your name on there, we'll send you the article, and you can call up and sign up for the ultrasound if you like.
And then, so when we talk about an issue that we might have business-wise, we always try to come up with what are 3 things we can do, whatever. So one of the things you and I have talked about is mouth health.
Yes.
Okay. That you recommend an antibiotic before you go to the dentist, right?
If a person is at risk.
Okay.
So,
Okay,
yeah.
so that's one thing to think about and to talk to your doctors about. If you're going to the dentist, whether or not you should take an
Yeah,
antibiotic.
specifically on that one, John, is that there was a study in 2013 in the American Heart Association journal called Circulation. All the cardiologists read it, where they looked at 101 heart attacks. So people were in the hospital with a heart attack. And they did the catheterization, they sucked out the clot of the heart attack, and they analyzed it for DNA evidence, DNA technology, DNA evidence of bacteria from the mouth. And the final conclusion on there was that up to 50% of those heart attacks were triggered. The match that lit the flame, like if you got a gasoline tank, it's not a problem until you throw a match in the tank and it explodes. Well, they thought that up to 50% of those heart attacks were triggered by bacteria from the mouth hitting a vulnerable artery and triggering an event. So if somebody has a soft plaque on CIMT, their inflammatory markers are pretty high, then what sometimes I'll do is there's a saliva test to look to see what bacteria you have in your mouth. And if somebody's got a soft plaque and they've got inflammation, you've got to treat the mouth. That's a huge root cause of disease, but it puts you at a little bit of a risk if you don't want that to happen. So what I'll do is, and I am, especially with gut health, I become very anti-antibiotic because that's going to mess up your gut health even more. But in that circumstance, you want those antibiotics like the catcher's mitt out there, trying to catch those bacteria before they nick the plaque there. So it's there's ways, and there's like mouth rinses that you can debulk the back. So there's a lot of ways you can do it, but the physicians aren't going to know anything about that.
So give them a couple of those, like mouth rinses and things that they can do.
So one thing, how I got into the dental population, got in the movie and et cetera, is that, there's these blood tests. There's a Cleveland Clinic blood test. One of them is called plaque 2. Don't worry about memorizing that. The bottom line is for the first 6 months, nobody was improving. I mean, normal was under 180. They were 250 to 350, and statins, weight loss, and exercise weren't budging them. So I went back and I looked at my training slides about the oral systemic connections, and I simply said, go get a Sonicare toothbrush, or a Oral-B makes a sonic brush. Go see your hygienist and use Listerine. And I started seeing these blood inflammatory markers reflecting cardiovascular inflammation plummeting through the floorboards left and right, 100 150 to 150 points, where it was going 10 to 30 with everything else. And basically, that's kind of the entry point as to how I ended up writing an article for the dental organizations to get them to understand. But so, the dentists I talked to say the sonic brushes, the goal of brushing and flossing is to break up a film of bacteria, again, the infectious origin of disease, breaks up the film of bacteria trapped between our teeth and our gums. And the mechanical, you can be the best toothbrusher in the world and to get to the end of the bristles. The sonic brushes reach about 2 to 3 millimeters past the tip of the bristles and break up a few more bacteria. So they recommend either the Sonic Hair or the Oral-B version. And then using a non-alcohol Listerine or one called Closis, and they actually get different bacteria. So I usually tell my folks to use Listerine after brushing in the morning, Closis after brushing in the evening. And so the flossing and brushing breaks up the bacteria, and the mouth rinses kill them. And those are the things that will help to kind of heal any gums that things are going on. And then making sure you get your teeth taken care of, because it does make a huge difference.
So I do that, I use Closis and Listerine, non-alcohol, so
Mhm.
it's called Zero. Listerine Zero, I think is what it's called. The other thing, I hated to floss. I just did, because I hated the string, my fingers were thick, I couldn't get anything but the front of my mouth, it seemed like, really well. And I would get pissed and like throw it out and just move on to, the next thing. So you ever see the tools now that they have, the little, it looks like this? They're awesome, I'm telling you, they're amazing, and they work really well.
Yeah, they're pretty good.
Yeah, and it gives you more control to get between your teeth, so.
I don't know if they're actually better than flossing, but if you don't floss, they're certainly
Yeah.
better than not flossing. And I'm the same way. I mean, they've got tight teeth and they break, and it's just a pain in the rear.
Yes.
So,
That's
yeah, these
like
things are simple.
Some brilliant person came up with that little tool. Because it makes at least somebody like me at least be able to do that. Okay, so you guys know that I like to have high-level business conversations, right, with all of you and things like that. You can imagine why I like Dr. Whitney, that we have high-level health discussions at least once or twice a year or something. And, getting an expert like this in your life is critical. We always talk about having 4 or 5 people in our lives, a financial advisor, right? We talk about spiritual, we talk about everything. But when it comes to health, have high-level conversations with your doctors. And if your doctor's not having that, find another doctor. And you can always go to Dr. Whitney if he's taking new patients. Sometimes he is, and sometimes he isn't. And so he happens to be at a place, I think, where he's taking.
I am temporarily, yes.
Temporarily, yes.
I'm
So-
looking for an associate, and
Yes.
temporarily, yes.
So at the end of the day, he's a giver. He's here because he's a giver. He's not a taker. And we match up in that area. We like to give. And so we just want to say thank you so much for coming, spending time, investing yourself in us. And would you give him a round of applause?
If you want to get the article and about the CIMTs, either just leave me your business card, write your name down on the pad. I've got my business cards here too, if you're interested.
Great, thank you. So next Wealth Building Wednesday will be in October. It will be business planning. We are going to do your business plan. You will leave Wealth Building Wednesday with a plan. You're going to know how much money, come with that, how much money do you want to make, right? And we'll put a plan around how do you do that. And really at the end of the day, for me, I want you to know how many new appointments do you need to make your goal. So we'll break it down almost to the ridiculous, right? You want to make this much money? Oh no, I got to sell 20 or 50 houses, whatever it is. And that makes you nervous. When you break it down to what do I have to do today and this week, it makes it a lot more tolerable, right? So that's what we're going to do. Tell everyone you know in the offices to come to that. We should pack this out. Everyone should do a business plan for next year. October is the perfect time to do it.
October 10th?
October, it should be the 10th, yes, second Wednesday. And also Gene Rivers is coming. He's one of the, in my opinion, probably the best Keller Williams University instructor that we have. He's coming October 19th to this area to do business planning clinic. That's a full day. What we're gonna do in Wealth Building Wednesday is make a business plan, but we're not gonna go through what the whole thing that Gene's gonna do. But I've taken Gene's class, I think 14 years in a row, this is maybe my 14th year. I learned something new because they change it and they update it. It's well worth going, all right? So if you want to think more like a business person than just a salesperson, you got to go to this class. You'll be impressed. So mark down. We'll send out the flyers on the next Wealth Building Wednesday. But if you can, bring your computer or your laptop, tablet, because I'll give you information that you can actually work with right in the class. And it's going to be really fun. It'll be cool. I'd actually like to figure out how much business are we all going to do in 2019. Like, wouldn't it be cool if we all told and we somehow tracked it, put it up on the board? It'd be probably pretty fun to say, we're going to do $200 million in volume in this room next year, something like that. So anyway, do you have any other questions or any other thoughts? Yes.
Yoga's tomorrow in here.
She's our health ambassador.
Thursday at 8 o'clock, gentle yoga.
Gentle yoga
Anyone who would like
in
to
here.
try it out, or if you just want to observe.
Observe yoga.
I had a question about the practice, and I'm realizing I didn't put the website up here. It's RHS, like the Practice Revolution Health Services, rhslivewell.com. Information about the practice, that map with the interactive map, the information is on YouTube. rhslivewell.com. It's on the business card too.
Can you go back one slide where you have those two books, please? Thank you.
Somebody take a picture and share it with everybody. All right, awesome. All right, well, thank you so much for coming.
Thank
Have a good day.
Yeah, no, I'm heading back to Jonestown to your house.
Nice to meet you. I was paying attention. Drinks recyclers, so I know you're all. Now I know I have to get off my car. So great. Yeah.
Yeah. Very eye-opening. Yeah, what he said that. Yeah, very eye-opening.
And you want to say what?
It's not on brand. It's the ubiquinol versus ubiquinol. O-N-E doesn't absorb as well as all of it is more expensive. Ubiquinol, so there's the two things. So you just have to kind of take a look at your bottle and see if it's ubiquinol or ubiquinol.
Yes.
You're going to be, ubiquinol is works better. It's just like alcohol, it's ubiquinol.
I thought his hair shirt was
That's, yeah.
Yes.
perfect. I don't know about your, Medicare does not pay for any prevention whatsoever. First of all, dirt cheap premium, it's good. It's amazing. It's perfect for that, because if that were to happen, it's a great God, just for like blood testing, and usually we have insurance, and that's circumstances.
That's right, good for you, yeah.
Thank you very much, it's very good.
All right, good, thanks for coming.
Happy is for everything that I do aside from the few.
I don't know if I should sign up.
At that age, I do kids, it's just I don't do it when but also the kidney curtain shots, I consider it. It's just more cross coverage. I don't have a really good setup for cross coverage when I'm out of town, like I do for the adults. So I pretty much say, yeah, like I visit the pediatrician till 12 or so, and I'll do it.
Okay, thank you.
You're welcome. Sure. All right, you're welcome. Hi. So, if the ultrasound shows sludge, it says gallbladder sludge, apparently that's just like itty sludge, high risk of obstructing and potentially for gallbladder cancer. So I've heard from surgeons, he says gallbladder sludge, take the gallbladder out. If it doesn't, then you really got to kind of, yeah, so it really depends on how lucky you feel. Or one of those, if there's big golf ball, ping pong ball ones, they're a big deal. They're never going to go, as long as you're not getting pain, you're getting surgery. The smaller ones, what's the risk of them getting plugged into the duct and having emergency surgery as opposed to an isolated. So it's always a case by case basis. It's kind of not my expertise, so I'm not sure when they do it or when they don't. Unless there's sludge, then you take it out.
Oh, okay.
Yeah, if you look in your